Health Organization is partnering with Facebook and South African-based organization Precalt to provide data-free COVID-19 information. This will help vulnerable communities around the world to access information about the virus. For more on that now, we're joined by Precalt's Managing Director, Debbie Rogers, who's live for us via Skype here in Johannesburg. Debbie, thank you so much for joining us this morning. All I can say is you had me at data free. That really is going to be a game changer in trying to get some really important information out there to the communities who need it most at this time.
Yes, absolutely. And this is really thanks to Facebook's Free Basics platform. They've negotiated with over 65 mobile network operators to ensure that this is available free of charge all over the world.
Now, these organizations don't often do anything out of the goodness of their hearts. How is it possible to get them all around one table and to agree that this is the best way to save many lives?
I think what's really important is that they see the really massive need for information, and also that they're trying to encourage people to learn how to use data services. So obviously that's where their heart lies. But they've come together to ensure that the most life-saving information is available for free, and I think that's really impressive.
And then it comes to your organization, not a huge organization. You're based in South Africa, on the other side of the world from where the WHO finds its headquarters. But it's not the first time you've been involved in something like this. You were involved with the WHO with the Heart Alert launch on WhatsApp. That was in March this year. And then more locally with the South African government. You were behind the COVID-19 Connect program on WhatsApp that really helped a lot of people, and a lot of people got on it as soon as they could, as soon as we started realizing how big this COVID-19 pandemic really was going to impact on our lives. What have you learned from those projects that you've been working on over the last few months?
I think we've learned just what massive scale we need to be able to operate at, because I think information about COVID-19 is something that every single citizen wants in every country in the world. And so the type of scale that we've been thinking about has been really impressive. The Health Alert service itself has reached over 20 million people worldwide. Wow. So it's taught us a lot about scale and infrastructure, but also just how hungry people are for the right information, and we thought it was the right thing to do to try and make that as available data-free.
How difficult is it, or talk to me about how you go about deciding what that important information is? Obviously, your organization has the tech expertise, but how then do you include the health expertise to ensure that the right information is being brought across in the best possible way?
I think that's where our partnership with the World Health Organization has really been incredibly valuable. They are the people who know what the right information is at the moment. They do a lot of work on making sure that it's scientifically vetted. And then we take further guidance, obviously, from the National Department of Health with respect to what's relevant for South Africa right now. And so we have amazing partners in the health space who are helping us to make sure that that is what is available. But we also listen to our users and understand what it is that they're looking for, and then ensure that by partnering with organizations like the World Health Organization, that information is in fact factually relevant.
Now, if I think back to March, as we headed towards our lockdown and we really started realizing the scale of this pandemic that was about to engulf the world, there was a lot of talk down here in South Africa about the lack of resources to try and get important information out there, especially to areas or to people outside of the major metros in South Africa, in languages that people understand, in a way that they could understand it, taking into consideration various education levels as well. And so you had to deal with that locally, but now you're also doing so internationally. So language is key. How you use animation and pictures and that kind of thing is key as well. How do you even go about deciding how to put messages out there, what languages to use, and whether that messaging is landing in the right way?
So I think, again, we have amazing partnerships. So the World Health Organization, for example, has provided their information in 18 languages, which already starts to go a long way. And then we partner with local governments to ensure that the work is translated into the appropriate language. But what's really important, as you say, is that it lands in the right way and that it's still medically sound. So we do a lot of work around translation and then what we call back translation. So we translate it back into the language and ensure that nothing has been lost in that translation. But we also do a lot of work around understanding what literacy level the information is available at, and try to put that at a lower literacy level to ensure that as many people as possible get the understanding of the information.
And now you say this project, as with many of your projects, is focused on markets where internet access may be less affordable. People in South Africa will say, hey, that's us. And I'm sure your organization very much part of the belief that information and access to information really should be free. Are you hoping that the kind of work that you're doing in these important spheres will start really driving home the importance thereof?
Absolutely. I think hopefully by showing just how many people need this information, how many people access it, and what the information is that they're looking for, we can help to change the minds of those who control the data out there to ensure that they make it available to many more people for free, or certainly the most life-saving information.
Well, so say all of us. Very much. Thank you so much for joining us this morning. Just very quickly before I let you go, this new project with the WHO, if people want to find out more about it, when will it be going live? Where can they find that information?
It's available now. It is live for Facebook Free Basics. In South Africa, you have to be either a CELC or MTN user to be able to access it for free. But you can go to zero.freebasics.com and search for WHO.
Okay, thank you so much for your time. That's Debbie Rogers. She's the Managing Director of PreCelt.org. Some very important information they're putting out there in partnership with the WHO, content focusing on how to protect yourself from the COVID-19 virus, how to look after your mental and physical health, and of course, very importantly, setting the record straight on fake news and misinformation.